Challenge today in mental health treatment, especially with TMS, a lot of folks have never heard of it, and TMS is transcranial magnetic stimulation. So transcranial through the skull, magnetic, not electric, and stimulation mean that we're able to activate patches of the brain, patches of cortex about the size of a nickel. So the best way to think about it is like physical therapy. If you busted your knee and you have to go do physical therapy every day, you don't show up on a Monday and run a marathon on Wednesday. It's a gradual process. And what we're doing here is sort of that same concept, physical therapy for the brain, where day to day it gradually gets better, where we're gradually rewiring or taking advantage of what's called neuroplasticity and using TMS to nudge those connections that are atypically connected today and make them stronger and stronger over a period of about 10 days.
All right, so today we're at 771 East Southlake Boulevard, and we're going to be visiting Suite 213, which is known as Compassion Neuroscience. I think we're in for a treat today. Several businesses that's going to be on the inside, so I want you to pay attention to that. But we'll take a quick tour as we navigate. You find the elevator, and we make our way to the second floor, and then you're there. So see you on the inside. Today we're putting the spotlight on another standout in healthcare, Compassion Neuroscience, located right in the heart of Southlake, Texas. This clinic, it isn't just serving the community, it's raising the standard on what mental and neurological healthcare should look like. From the moment you step inside, you can feel the calm, welcoming energy. The space is clean, it's modern, and is designed to help clients feel safe and supported. But what really makes the place stand out, it's in the name, Compassion. Their approach is rooted in care, science, and connection. They specialize in evidence-based treatments for anxiety, depression, PTSD, ADHD, and more, all backed with the latest neuroscience. The Blvd team, highly trained and locked in, with a clear mission to bring healing and hope to every person who walks through their doors. Did you know over 1 in 5 U.S. adults experience mental illness each year? In clinics like this, they're stepping up to provide real answers, not just quick fixes. If you're near Southlake or just outside the Dallas-Fort Worth area, this clinic is worth checking out. You can learn more at compassionneuroscience.org. Tap in and see why Compassion Neuroscience is a name worth knowing. Let's talk about the vibe the moment you walk in. Compassion Neuroscience knows how to make the first impression. The reception area hits you with comfort and care right out of the gate. And we're talking about a fully stocked snack station, a mini fridge with cold drinks, and just the right touches to make you feel at ease while you wait. But it doesn't stop there. Check out the whiteboard filled with motivational quotes that hit you right in the soul. It's not just decor, it's the daily reminder that you're in a space that cares about your mental, emotional, and physical well-being. This ain't your typical cold clinic waiting room. It feels like somewhere you actually want to be, and that matters. Next stop, the treatment room, and I'm already feeling like I'm in good hands. Let's explore more. Good morning.
Good morning.
And you are?
I am Heidi Toll, registered nurse over at Compassion Neuroscience.
Oh, wow. So what's your background in nursing?
My background, I came from Stanford University Children's Hospital. And as a mom of 3 and a nurse, I have the background of both mom and medical. So I feel like I can actually bring that together and have one step above all the other medical offices that might have TMS.
And what would, like, some of the moms that would visit or frequent your facility here, what are some of the questions that they generally have that you can answer for them, or how do you put their mind at ease?
A big part of postpartum depression, they want to make sure that this kind of treatment doesn't pass to their child through either breast milk or any kind of drug that would go through the blood-brain barrier. This does not cross over. So you could be having treatment and your baby is just sleeping in your lap, or you can also be antepartum and carrying your baby and have the peace of mind that it's not even affecting them at all.
That is awesome. Nice to meet you, Heidi.
Nice to meet you too.
Now let's get into the heart of the healing, the treatment room. This space is calm, clean, and intentionally designed to help you feel safe, relaxed, and fully supported. No harsh lighting, no cold clinical vibes, just a peaceful setup that lets you focus on what matters, your healing and your progress. Whether you're here for neuroimaging, TMS, brain performance evaluation, or consultation, the room is set up to keep you centered and comfortable. Everything from the seating to the lighting says you're in good hands. This isn't just a room, it's a space where transformation begins. Real care, real science, real results. Hey, good morning, Doc. How are you doing?
Doing well. How are you?
I am wonderful. So please introduce yourself to the world, Doc.
Sure. I'm Russ Toll. I'm the executive director here at Compassion Neuroscience. We're a TMS clinic that specializes in applying the tools of neuroscience to mental health.
That sounds quite impressive, but it also sounds kind of daunting. Help break that down for the average viewer like myself.
So the mental health treatment, especially with TMS, a lot of folks have never heard of it, and TMS is transcranial magnetic stimulation. So transcranial through the skull, magnetic, not electric, and stimulation mean that we're able to activate patches of the brain, patches of cortex about the size of a nickel. So the best way to think about it is like physical therapy. If you busted your knee and you have to go do physical therapy every day, you don't show up on a Monday and run a marathon on Wednesday. It's a gradual process. And what we're doing here is sort of that same concept, physical therapy for the brain, where day to day it gradually gets better, where we're gradually rewiring or taking advantage of what's called neuroplasticity and using TMS to nudge those connections that are atypically connected today and make them stronger and stronger over a period of about 10 days.
So help me understand, I guess, your ideal target audience. Who could actually benefit the most from your services?
So we serve 4 primary populations. Those primarily are Gold Star family members. Those are members who have lost their loved one in the line of duty in Iraq, Afghanistan, law enforcement, etc. And as a casualty officer, I'm an Army combat veteran myself, and when I returned from Iraq, what I noticed working with Gold Star families is that the VA takes care of the spouse and the children, but there aren't any provisions for parents and siblings, and that was a gap that I felt absolutely needed to be addressed. If we are going to help anyone, it's going to be our Gold Star family members. Gold Star family members are treated for free for life here at our nonprofit clinic. The second population we see are veterans, fellow combat veterans. I see a lot of Marines, a lot of soldiers, airmen and sailors, and we get them taken care of at cost. And then the third population that we see primarily is postpartum depression and peripartum depression. Those are our moms who are struggling in that phase. And this is a very advantageous treatment for them because it's non-pharmacological. If you're breastfeeding, we don't want to put sertraline or fluoxetine in the breast milk as step 1. We want to do a non-pharmaceutical intervention that has no pass-through effects to the baby. So that's one of the primary advantages of TMS in postpartum, is that it cannot affect the child. And then our last population is pretty much everyone else, where TMS is FDA cleared to treat depression, anxiety, OCD, and it's used off-label for PTSD and a variety of other conditions.
So Doc, you're telling me with magnets, you can treat all those symptoms that you just mentioned.
That's right. And if you should be skeptical of that, and what you would want to do is go to pubmed.org and look at the peer-reviewed scientific literature. There you'll see articles in the Journal of the American Medical Association, the American Journal of Psychiatry, and you'll find that I'm an author on a good number of those papers. So if you want it provided by not just someone who's familiar with technology, but someone who's an author of the technology, this is where you want to go.
So help me understand, how long has this technology been around?
So it was FDA approved in 2008, but it's really come into its own in the last 10 years. That's been a lot of the recent FDA clearances, like anxiety with depression and OCD, have been approved by the FDA. And it's become more and more popular as people see the results that are able to be achieved with it, especially without pharmaceutical intervention. That's been, especially for our veterans, that's been a primary concern. Is I'm done taking pills. I just want to try something that has a physiological, mechanical application to a mechanical problem.
So you're telling me this is safe, is what I'm understanding?
Yep, it's FDA approved in pregnant women and adolescents down to 15 years old. So if you're approved in those two populations, that's as safe as it gets.
Are there any side effects whatsoever?
There are. The most common side effect is headache, which typically resolves in about 5 minutes. And you can take, Tylenol, ibuprofen, whatever works for you beforehand, and it's really not that big a concern. And there's a vanishingly small, 1 in 30,000 chance of seizure, but again, the best way to look into that is PubMed.org and look at the safety and efficacy studies and see what those rates are. In 15 years of doing this, I have never seen a seizure.
Doc, so your practice is located here in Southlake, Texas. Help me understand, do you have competitors?
There are other people doing TMS, but we don't really see each other as competitors because depression is the #1 disability in the world. So even if all of us were at max capacity and going around the clock, we still couldn't put a dent in it. So we have a very collaborative atmosphere in the world of TMS. What makes us different is we use a technology called neuronavigation, which I worked with extensively at Stanford, and that's what we're applying here. Neuronavigation is the ability to look exactly where you're going to hit in the brain in real time and know precisely down to less than a millimeter where your accuracy is landing.
When it comes to leadership that hits different, Dr. Toll, he's the real deal. He's not just running a clinic, he's setting the bar with brains, discipline, and purpose. Let's talk credentials. A master's and a doctorate degree in bioengineering, both from Stanford University. That's not just elite, that's top 1%. Honorably discharged from the U.S. Army, bringing military precision, resilience, and discipline into every aspect of care. A proud graduate of the United States Military Academy, so you already know he's built different, and he's blending world-class science with real-world leadership to create a space where neuroscience meets heart. Patients, they don't just get treated, they get treated with vision, intention, and respect. Dr. Toll's journey is proof that when you mix elite education with service-driven leadership, you get something powerful. Doc, please introduce your equipment to the rest of the world.
Sure. So we have 3 primary technologies here that really set us apart. The first is EEG on the back of that wall, and you can see the brain rotating on the computer here. What EEG does is gives you a picture of what's happening in the brain, a picture of connectivity. So we use that EEG to measure those electric potentials in the brain and answer the question, what's connected to what? And get this wiring diagram and be able to compare that to libraries of healthy control populations and understand how is your brain functioning on a day-to-day basis at that baseline. That helps us take a look at what your brain looks like today before treatment. We do an EEG at the conclusion of treatment, and then we're able to sit down and answer the question, what changed? What were we able to accomplish with TMS? So step 1, EEG. Step 2 is TMS. This is the treatment coil. And once you're in the chair, what you see here is step 3, neuronavigation, where we're able to look exactly where we're going to hit and use an MRI to identify our targets and make sure that we're on target to within 1 millimeter at every stimulation session.
That sounds quite impressive. And you're telling me all this could be done in 10 days?
10 days is our accelerated protocol. The standard protocol is over 6 weeks. That's 1 stimulation a day, 5 days a week for 6 weeks for a total of 30. We do the equivalent of 3 days per session over 10 days to get that same 30 equivalent dose, and then we transition to once a week maintenance.
Do you feel this treatment at all?
You feel a gentle tapping on the head. It's almost like a little woodpecker's tapping, so it's definitely not painful. TMS, you can do the things that were once difficult with a little bit more ease, day to day, getting stronger and stronger, and having that connectivity come back into balance.
So, Doc, help me also understand, how will one pay for this? You mentioned not to go, you say ghost tour families are free.
That's right.
You treat a lot of veterans, postpartum depression amongst women.
how do we pay for something like this?
So all of our treatments are delivered at cost. We're currently in the process of negotiating with different insurance companies, but we're not quite there yet. So right now we're doing cash pay only, and we can work out those terms to make it very affordable, where it's effectively about the same as a copay.
So Doc, let's say I come to you for treatment, you do your 10-day or your 6-week program, and I'm on medications. Can I give up those medications, or I'm still going to be using medication?
So typically you can stay on. We want to change as little factors as possible. In order to do good science, you minimize the number of variables. And that's why that clinician judgment, that clinician supervision is so important. So to get into TMS, you first must have a prescription, and we take care of that by working with your existing doctor, where they do the evaluation. They will write the script. They'll say, I diagnose you with this, I prescribe TMS. And once that's established, we have our treatment plan, and we go right to stimulation.
You also mentioned that, again, 10 days, 6-week program, but the actual treatment itself, how long is that?
So typically each visit is somewhere around an hour. The shortest it could possibly be is about 15 minutes, and that's for that once a day, 5 days a week for 6 weeks program. The accelerated 10-day protocol, that's where it's about 60 minutes per session for each of those 10 sessions.
Is it possible, Doc, to get a demonstration?
Absolutely. Would you please have a seat?
Sure.
So this is how neuronavigation works. We're able to just take a regular headband, put that on our patient, adjust that to where you like it. And then we have a tracker, and that tracker attaches here, and you can see this infrared camera looks for it, finds it, and reports that it can see it. The next step is to define certain landmarks so the computer can match to the MRI. And the next step is defining the scope. So we just put our pin here, we start tracking, and you can see those green dots start to appear. This is just showing where on the scalp our boundary is. Once we have that, we proceed to neuronavigation. And now it looks a little scary in the MRI, but if we move up a few layers, we can go from the head to any point in the brain that we want to stimulate. We can define targets throughout. This is her motor cortex in this area, so I can give you an idea of what that looks like for what's called a motor threshold. So now you can see we know where her head is, and we know exactly where we're going to land throughout the brain. We'll make sure that we can get you a good picture here. Let me bring it back a little more so it's easier to see. Just like that. And the actual stimulation looks and sounds something like that. And if we increase, I know hers is around 40, you can find that area of her motor cortex. If you want to put your right hand in your lap, palm up. You'll notice that little twitch in her hand. That's us controlling her motor cortex. That's one of the coolest things about TMS is you see it work right before your eyes. So it's fine to arrive at skeptic, but once we do motor threshold, you'll be convinced of one thing, that this machine does something with the brain. I can demonstrate to you that I can affect your motor circuitry just like that, move your hand like a puppet. You can even fight, try to lock out your hand and resist. You can't. Maxwell's equations always win. So if I'm able to affect motor circuitry in a fashion like that, we can affect cognitive circuitry and affect the circuits that handle depression, that handle anxiety, that handle OCD and PTSD. So that is what's super cool about TMS, is the ability to actually see it work. So depending on the condition, we'll find various targets throughout the brain and have a stimulation record where we know exactly how much was delivered, to what point, at what time, and use that to record progress over the entire treatment schedule. And when she comes back in the next day, instead of having to take off a sprint cap, put it back on and hope that we got good alignment, we just do that procedure that you just saw, nose, ears, trace the scalp, and we know down to a millimeter where we're going to be. That enables us to be precise, accurate, and repeatable.
So no gels, no liquids, just the band, and that's about it, right?
That is. And then band comes right back off, and you can drive out. You don't need anyone with you. It doesn't require an assistant. So you can just swing by. Nobody knows why you're here. You just come in, do that 15 minutes if it's the common one, or up to 60 minutes if it's that accelerated protocol, and get on with your day. I'm sure you have a lot of questions because most people have not heard about TMS. It's a lot of information to take in. So just go to compassionneuroscience.org. All that information is laid out there so you can go through the literature at your leisure and take that information to your current doctor and see if TMS is right for you.
That's a wrap on this walkthrough of Compassion Neuroscience. And if you couldn't already tell, this place is built different. From the warm energy at the reception area to the cutting edge care backed by Stanford level science. This clinic is all about real solutions with real heart. And if you're looking for support with anxiety, depression, PTSD, ADHD, or more, or you just want a provider who actually listens, this is where you want to be. Compassion Neuroscience blends next level brain science with down to earth care. Getting here is quite easy. From DFW Airport, head north on Texas 121, take the Southlake Blvd exit and roll west. If you're already on Southlake Blvd, heading east, just keep it moving straight. Compassion Neuroscience is right off the main strip. You want to learn more or you have questions? Visit compassionneuroscience.org or call the team. They're ready to talk, help, and guide you through every step. Your peace of mind has a home, and it's right here in Southlake, Texas.